All right, now I'm just gonna do standard precautions, wash my hands and put my gloves on. My patient has rotavirus and gastroenteritis, so he's on contact precautions. There it is. Alrighty. Okay, I already washed my hands. Okay, now I'm putting gloves on. Alright, now I am knocking on my patient's door, opening the door and doing a general check. Okay, my patient appears to be kind of uncomfortable. I see that his face is grimacing and wincing, and he appears uncomfortable. He also kind of seems discolored and sweating, and yeah, that's his general appearance. I'm getting a general vibe. The mother's at the bedside supporting the patient, and now I'm going to proceed with introducing myself. Hi you two, my name is Lainey. I'll be your nurse today, and I'm so excited to meet you guys. How are you feeling today? Oh, he's not feeling very talkative. I'm going to ask his mom. So how has he been today? Okay, yeah, I'm sorry that you guys are going through this. This is not fun. I'm so sorry. Well, like I said, I'm Lainey. I'll be the nurse today. I am in here to do an assessment and carry out some of the doctor's orders, which include medications and assessing his dehydration and stuff that you guys have been dealing with, like his fever, and check on those things, okay? So do you have any questions for me right now? I'll explain more as we go along, and if any questions come up, please know that you're more than welcome to ask. Okay, so first up, I'm going to take my patient's vital signs. Okay, so I'm going to do the blood pressure. The normal range for that is 80 to 100 for systolic, 50 to 70 for diastolic, heart rate 70 to 110, temperature 36.5 to 37.5, respirations 20 to 30, and we want his cap refill to be less than 3 seconds. We want his pulses to be +2, palpable and not diminishable on palpation. And we want his skin turgor to be less than a second. And I'm going to check all of that now. Okay, great. Now I've got his vital signs done. His blood pressure is 90/50. His heart rate is 135. His respirations are 37, 38-ish, and his oxygen saturation, we want that to be above at least 90% per the doctor's orders, and it was 92. And his temperature, of course, his temperature was 39 degrees Celsius, which is out of range. The reasoning for all of this, his fever, is due to that ear infection, and also he has an infection in his bowels, which can really bump up the temperature. He has a little bit lower blood pressure on the end of normal. It's in range, it's okay, but it is on the lower end because of that dehydration. Along with that, he appears to be in pain. I haven't assessed his pain yet, but his heart rate is fast, so I expect to see some signs of pain as I move forward with doing the FLAC scale. And his respirations are a little bit elevated as well because he's uncomfortable and stressed out. He's just overcompensating. Yeah, so now I'm going to carry out the doctor's orders and take care of those out of range vital signs. I do want to assess his pain score. Okay, hi buddy. So my name's Lainey. Can you say that? Oh, are you sad? I'm sorry, Wes. And he told me his name. So your name's Wes? Okay, great. Do you know who this is? Who is that? It's Elmo. Oh, do you like Elmo? He told me what Elmo was. He named Elmo. That's great. Okay. Do you know where you you are today, bud? At the doctor? Yeah, that's pretty good. Yep, that's right. And do you know who that is? That's mom. You're right. Okay. So he's not feeling very talkative to me. He's kind of off standish, but I'm establishing a relationship. And his neurologically, I mean, I just assessed he's LC times 4. Of course, I still need to do the pain scale, but to introduce myself, I wanted to establish his orientation and level of consciousness while getting to know him. All right, so I guess I'll use faces today instead of FLAC. So this is still appropriate, unless I have FLAC. I'd prefer to use FLAC, but faces will do. Faces will do. Okay, Daddy, can you point to which face you feel like? Which face fits you? What do you think? Okay, yeah, this one? Okay, he says that this one fits him the best, so a 6. It hurts even more. He's this orange sad face, huh? Okay, well, let's take care of you. I'm sorry. Where are you hurting? Where's your hurting? Oh, your ear? Oh, I'm sorry, buddy. And your tummy? Okay. Well, let's give you some medicine. Does your mommy give you medicine when you're sick? Okay. All right. So now I'm just going to do an assessment. I'm going to put extra focus and emphasis on his abdominal region and fever. And of course, to assess his hydration, I want to really pay attention to what the skin's telling me. Okay. All right, bud. Wow, you're so tall. Wow, okay. So I've assessed his neurosystem. I have my pen light here. I'm going to assess his pupils. So he's LOC times 4. Okay, buddy, have you ever used a flashlight? You know what a flashlight is, huh? Okay, open your eyes. Big. Ready? Oh, good job. Good job. Okay, so his pupils are perla. Pupils are equal, round, reactive to light, and accommodation. And let's see what else. Okay, his fontanelle's not there anymore, so I can't really assess that for dehydration. Okay, but his cranium looks good. Okay, next up, I'm gonna go ahead and listen to his heart. Have you ever seen one of these? Oh my goodness, look. When you listen, you can hear stuff. This lets me hear it. It's like a microphone. Yeah. All right, I'm gonna inspect his chest here, quickly do a skin trigger while I'm there. Okay, it was a little delayed. It was about 2.5 seconds on recoil. Okay, all right. His chest looks of normal color. I don't see any abnormalities or deformities visually. Okay. I'm gonna go ahead, listen in 5 different spots: the aortic, the pulmonic, Erb's point, the tricuspid valve, and the mitral valve. Okay, and what I'm hearing is S1 and S2 sounds, no murmurs present. Okay, that was fun, huh? I heard your heartbeat, you know, bump, 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 bump. Yeah, that's great. Okay, and while I did that, I could hear some breath sounds too, but I'm gonna go ahead and listen. Take a deep breath. Good job. Good job. Okay, and I'm not hearing wheezing or crackles. I'm definitely hearing faster breathing, but it doesn't sound too labored. I'm not really worried respiratory wise. I hear normal breath sounds equal in all lobes, and same with the heart. Okay, so now I'm gonna look at his abdominal region. So, and while I'm doing this, I want to talk to the mom. So when was his last bowel movement? Oh yeah, that's right. The previous nurse told me it was right before shift change, and it's still runny. You're still having diarrhea, yeah. Okay. And you know with that we really want to pay close attention to his eyes and nose, his intake and output. So anything that you give him, any sips of water or anything like that, and also his diapers, please let us know. We're happy to come in here and weigh them, because we have to replace every milliliter that he loses, okay? All right, and I'm sure they've already told you that, but just to reiterate the importance. Okay, and we're happy to help with diaper changes too, okay? So yeah, I looked at the abdomen, no abnormalities. It doesn't look distended or anything. He's definitely kind of shielding his abdomen. I can tell that it's tender. So I'm not going to palpate super hard, but first I need to listen to it, of course. So no abnormalities upon looking at it. Okay, so now I'm going to listen. I'm using it again. Okay, so I'm definitely hearing hyperactive bowel sounds. I made sure to listen and get a good idea of how frequent they are. They're a little hyperactive, which is makes sense with his diarrhea. And I just want to palpate. Yeah, it's definitely tender, but I can tell that now he trusts me and is letting me touch it more. Yeah, okay, I'm sorry, bud. Oh, man. Okay. And I also am going to ask about his urine output. So how many wet diapers has he had? Yeah, that's what they said, is that he's been waking up with drier diapers than normal, right? Because we're not potty trained yet. Yeah, okay. So that's because of his dehydration. So we want to give some fluids today to help replace that and make that output greater, okay? All right. So just let us know anytime he pees. Same with this stool we want to replace, and make sure we keep a close eye on that. Let us know if you have any concerns, okay? But I understand he's had 2 wet diapers since he woke up. Okay, great. Thank you for letting us know that. I also need to check the skin. So I assessed the turgor. It was a little bit delayed. He is dehydrated. He does feel warm, but he appears to be perfusing everywhere. Okay. Oh, and earlier I didn't check the pulses. I'm going to go ahead and quickly do that. Okay, I feel bilateral brachial pulses and radial pulses. Great. And I'm going to go ahead and flush that IV site to ensure it's patency as well in a second. Okay. Yep. I hear bilaterally. His cap refill. Oh, dang it. That's about 5 seconds. He's dehydrated for sure. And as far as musculoskeletal goes, I understand that he's been getting up occasionally. He really wants to stay in bed, but I understand that his range of motion is good. Okay. Can you squeeze my hands? Oh, good job. Good job. Okay, great. So his skin is kind of redder. He's a little bit more flushed. It's warm. His turgor is slow. His cap refill's slow because of that dehydration. Okay, great. Now I'm going to proceed with administering those medications. So just to do another check here, I have my new gloves before I get medications. All right, so I do need to notify my provider as soon as I'm finished with my patient, because he did have some vital signs that were out of range, but I want to carry out these interventions that have been ordered. Oh, and I also want to ask my patient's mom, how has he been tolerating the bratty diet? Yeah, I know, it is hard. It's definitely hard. He just likes mac and cheese. Yeah, I know. Hopefully after we get this diarrhea slowing down and him more comfortable, maybe he'll have more of an appetite. Yeah, okay. All right, bud. Do you want to hold Elmo? Yeah, that's great. Oh my goodness. Okay. All right, I'm just going to check this IV, okay? Has it been bugging him too much? It was at first, but now it's better. Oh, that's good. Go ahead and scrub my hub. I want to make sure I keep this clean. It's super important, especially with our pediatric patients, to make sure that procedures are antiseptic and clean. I feel like this is, it's not clamped, but maybe I just had it twisted weird. Okay, now it's flushing just fine. Boop. Okay, well, for the sake of this simulation, we'll pretend that this is flushing just fine and that I've ensured the IV's in place. Great. Okay. All right, you want to hold Elmo? Perfect. That came untied. All right, I'm just going to quickly give his oral medications. So here I have his amoxicillin and his acetaminophen. Okay, so how does he tolerate taking medications? He used to be bad, but now he's okay with it. Okay, well, if you'd like to, you can. No, it's okay if I do? Okay, great. Just want to make sure I'm involving the parent in the care to make sure that they're not feeling a super strong loss of control, that they still are part of taking care of their child. Okay, great, great. Yeah, he took those no problem. Great job, Wes. All right, next I'm just gonna get his IV fluids going. All right, so what we've got here is an IV bolus, meaning that we want to give him a lot of fluid right to start, because he is dehydrated. His vital signs showed that, as I was kind of explaining as I went. And so we want to give him an IV bolus. And the other thing we want to do is a stool replacement therapy. So this means, like I was telling you, that we want to replace each milliliter that he loses, which is why that output and intake and output is so important to keep a good track of, so we can make sure that we're replacing it to keep him healthy and hydrated, okay? All right. Got some great keep tubing here. Good, okay. Now I'm gonna go ahead and start my IV bolus. I just flushed this site, and where'd my alcohol swab go? Okay, go ahead and scrub my hub again. All right. Okay, now I'm going to program the pump. Check the doctor's orders here on that IV bolus. Okay, great. Yeah, so he wants, the physician wants him to receive 272 mils. So I'm going to go ahead and program my pump here. Okay, great. So that's all connected. I've got it open. Yep. Okay. That's good. I'll start receiving that. Okay. Next up, I want to do his other one. So now I'm going to calculate his stool replacement mil per mil. So here I have his output. So total, we're just replacing 130 milliliters. So after this 272 is done from his IV bolus, I want to go ahead and make sure I program my pump to replace that other 130 mils. Okay, so now we're going to start the IV maintenance fluid. We'll pretend that the bolus is done, that the stool replacement is done, and now we are doing maintenance fluid, okay? Okay, scrubbing my hubs, keeping things clean. Okay, perfect. So now I'm going to program that, my maintenance fluid at 47.2 milliliters an hour. Okay, great. And throughout this process, I want to keep in mind that I need to reassess his hydration status as soon as my innervations have been had time to take place. I want to make sure that what we're doing is working for him. So I want to make sure his pain decreases. I'll reassess that in the appropriate time frame, which for acetaminophen is about an hour. I'll come back and make sure that he is feeling comfortable. And I want to assess his hydration again. I want to make sure that I'm updating my intake and output and replacing per provider order. And I want to make sure that I'm educating my patient. So the reason that we gave those medications, like I said earlier, is amoxicillin is for that ear infection he's got going on. Acetaminophen is to help with any of that discomfort, but also his fever. We want to bring that down. Something you might want to be aware of with amoxicillin, one of the oral medications I gave, is that sometimes people can have a hypersensitivity allergic reaction. They can develop a rash, usually on their chest area, but just pay close attention to that and please let us know. He doesn't have an allergy to amoxicillin listed in his chart, of course, or else we wouldn't have given it. But if you see that show up, please let us know. And with acetaminophen, if you feel like the dosage isn't right, if you think that his pain is just not being treated, if he's still just uncomfortable, please let us know. We want to do whatever we can to help. The same thing kind of with the acetaminophen. If you see any rash show up, it could also be that causing it. If you notice that he's more drowsy or lethargic than he has been while he's been at the hospital, let us know, because that can be a side effect as well. So yeah, to sum up our teaching today, please make sure you're strict with the I's and O's, and I've taught the importance of that, and we want to keep him comfortable and safe. And also please let us know if we can help with diaper changes or just to come in here and watch him for a little while you get some air. We are more than happy to help you, okay? So now I'm going to take the vital signs again. It looks like his blood pressure has increased just a little bit, which is great because he was dehydrated before. His heart rate went down a little bit to 112. Earlier, I think I said, let me check my MAR, but not my MAR, my electronic health record and compare. But yes, his fever's come down to 37.2. We're treating that appropriately. His cap refill, it was 5 seconds. Now it's 3 seconds. Great. And of course, this is later after I've given the interventions time to do their job. But I want to make sure I'm leaving him safe and clean and comfortable. So make sure that anything is out of the way that could pose any sort of danger to him. Teach my mom to let me know. Do you want to keep this, buddy? Okay, you can keep that in here. Okay. And we've recessed his pain as well. And what would you say it is now? Oh, okay, so just a 2. It only hurts a little bit, so he's back in the green. Okay, great. And if I wanted to teach my mom about this, I could. So he is 30 pounds and 35 inches. So I can show my mom here. Oh, look, so this is about where he lands. Yeah, it looks like he's great. He's growing great. Yeah, I agree. He's such a handsome little boy. Okay. Sure. Don't need anything else. Of course, I'm going to clean up my equipment. Don't want to leave these in the room. Okay. And now I'm going to leave the room, call the provider, and notify him that the patient had a fever, but that it came down. The blood pressure was low, but that it went up. The heart rate was high, but then it went down. His respirations, also I assessed those, and those were now lower too. They're now within range. They're 28 instead of 36 or 37 like I said earlier. And that his hydration status looks like it's improving, that we'll continue to monitor intake and output for my patient. And that is all. Thank you.